Welcome to Improving Interprofessional Communication and Introducing TeamSTEPPS National Implementation by the Association for Health Research and Quality in Education. My name is Cindy Nelson. TeamSTEPPS training occurs via a train-the-trainer method of train-up. 1 teaches 24, each of the 24 instructs another 24, and so on and so forth. At this rate and with this method, there's a potential for train-up of over 1,440 individuals within 6 months of the TeamSTEPPS process. The framework and competencies of the teamwork
are based on a shared
TeamSTEPPS
mental
process.
model of mutual
Have 5
trust,
key
team
principles
orientation,
are based on team structure
and a performance
and
modification
learnable
of
skills,
all
communication,
involved,
leadership,
considering
situation
adaptability,
monitoring, and mutual
accuracy,
support.
productivity,
The arrows
efficiency,
depict a
and
two-way
safety.
dynamic interplay
Above
between the
all
4
else,
skills and the
safety.
team-related outcomes.
This is through
Interaction
the Joint
between the
Commission
outcomes
on
and skills
Accreditation.
is the basis of a team striving
5
to
key
deliver
principles
safe,
are the
quality care
communication,
and support
leadership,
quality
team structure,
improvement.
situation monitoring, and
Encircling
again,
the
mutual
4
support.
skills is the team structure of the patient care team, which represents not only the patient and direct caregivers, but also those who play a supportive role within the team care delivery system. Communication and interprofessional behaviors occur all at the same time. Some of these behaviors can be noted as SBAR, callback, and call out. In discussion of these, one of the examples of both the SBAR and the callback would involve a leader giving information, a responder clarifying information, another leader again asks for information, the responder again clarifies the information, asks questions. Again, the leader would so on and so forth continue, message sent and received. Via this method, this is called closed loop communication. When the loop is closed, everyone has received the correct and adequate amount of information. Time should be of no consideration. Leadership is of primary importance in the TeamSTEPPS process. This will assist in directing and coordinating all assigned tasks, keeping the team motivated, members acknowledging facts and situations that are occurring, and any safety or incident risks that may be involved. These may occur through a brief, information given, a huddle, a gathering of forces prior to the work situation, and a post-debrief after the work situation. All methods should be clarified and questions asked before the task has been considered completed. Again, closed loop communication. Now let's have some
TeamSTEPPS is
fun.
based on
Let's
mutual
talk about
support,
a two-challenge
advocacy,
rule.
and
A two-challenge
assistance.
rule
There
is
always
when
the two-challenge
you
rule,
really aren't sure
which
that
can
you
also
heard
be
what you
considered
thought
the
you
please
heard.
swear
So
or
you're going to
cuss.
discuss with
I am
someone the
concerned,
situation
I am
and your
uncomfortable.
awareness
This
of
is
it,
a safety
how
issue.
you would like to
Please stop
share
the line.
your mental ideas of this, your concerns and your questions of how this will affect outcomes, how you have monitored the situation, and again, how it rotates back to situational awareness. Challenge and re-challenge until you are clear. But don't forget to swear. Swearing sometimes can be fun, only if it is in the process of concerned organization. Under the method of cuss, you are concerned, you are uncomfortable, and you are stating this is a safety issue, and you want others to stop the process of what is occurring right now at this instant. If something isn't quite as challenging as a cuss, you may use the DESC script. DESC script involves a constructive approach for managing and resolving conflict. First, describe to someone the situation. Express your concerns about what is occurring. Suggest possible other alternatives. Maybe mention the consequences that should be notified or understood by them or by others that are around there in the situational awareness. If the situational awareness is not accurate, please consider a mental model, a team outcome. Will this affect your situation monitoring? Will it affect individual skills? Think about it. This will all rotate back into itself into situational awareness. This is part of mutual support under advocacy and assistance. All right, so let's round up our thoughts. Don't forget, the TeamSTEPPS 2.0 process is a great method to increase evidence-based quality, safe outcomes and decrease injuries, risk, and assumptions of errors in the work environment. Let's look at a few barriers. We do not want to have anybody base their actions on defensiveness, hierarchy, lack of information sharing, or lack of time. Remember, time is not of consideration, and everyone should stop and take information at the point that it is given. Be aware of distractors, fatigue, workloads, misinterpretation of cues, and lack of role clarities. Above and all else, lack of role clarity. Don't forget to use your tools or your strategies, such as the SBAR, call out, check back, and handoff. Don't forget to be a leader. Everyone's a leader. Everyone can go take apart issues of others, but everyone also has to remember that they are a leader. Always base your thoughts on situation monitor. Are you safe? Are you having everything implemented accordingly? Don't forget to provide mutual support, task assistance, feedback, and use your 2-challenge rule. Don't forget to swear, and always be descriptive in what you are requesting. This will provide good evidence-based outcomes according to the Joint Task Commission Association, the American Nurses Association, the National League of Nursing, and your state board of nursing. Do not forget to use the shared mental model. Be adaptable. Help lead your team towards great orientation. Respect and give mutual trust. Provide team performance in the best way you can, and above all else, monitor for patient safety. Thank you.